And now we move to the active phase of labor. Here I would like to divide the active phase into two parts. Dilation from 5 to 7 to 8 centimeters, and dilation from 9 to 10 centimeters. Let's talk about the first stage. At first, when the active phase is just starting, the woman is already in a certain rhythm of her contractions. She has already started breathing for the contraction, started behaving differently between contractions. She is already starting to sink into such a trance state. It is a very good state to aim for during labor, and it is very important that no one brings the woman out of this state, but instead helps her sink deeper into it. Because when a woman is in a trance state during labor, she experiences the birth with as little pain as possible. She is almost not here anymore. She doesn't think about what is happening. She doesn't count how much time is left. Generally speaking, she doesn't care anymore. She takes comfortable positions, makes things easier for herself during contractions, and basically, she feels good. She catches the endorphins that are released during labor in response to the sensations of the contractions. At this moment, as I already mentioned, it is time to head to the maternity hospital. If the partner notices that the woman has a distant, hazy look, her gaze is fixed, and she no longer cares where she is giving birth or where she is, now is the time to pack her bags and drive to the hospital. At the maternity hospital, you can again create a comfortable environment for yourself. Dim the lights. Close the blinds if there are any. Maybe put on headphones if you are alone or if someone nearby is distracting you or preventing you from focusing and tuning in. You can turn on pleasant music or use LED candles. Basically, create whatever atmosphere feels most comfortable for you. If the lights around you are too bright, you can prepare a sleep mask in advance and wear it in the delivery room. This will also help you disconnect and focus inward. Regarding breathing. At this stage, it is more effective to breathe out with effort rather than just relaxation. The exhale can be stronger and longer, and you can incorporate various sounds here. We will discuss breathing in more detail at another time. This helps. You can sing, you can move, you can dance, making smooth hip movements. This helps the baby engage better and rotate through the pelvis. This also shortens the duration of labor. If the baby is positioned correctly, it helps. You can use a hands and knees position, you can sit on a football, you can lie down, or you can stand while leaning on a windowsill. Do whatever helps you. In this situation, it is absolutely normal, no matter what a woman does. Some women undress completely. Some crawl under the sink in a strange pose. Some lift a leg, some walk in circles around the room. You must understand that whatever you do, it is normal. Allow yourself to behave however you want because these are your births. It doesn't matter who is watching, especially since hospital staff have seen it all. Believe me, it is much more important to them that you are managing the contractions and not calling for them or bothering them unnecessarily than if a woman is lying there screaming and constantly calling someone. What else helps? You can use essential oils. For example, peppermint oil helps if you feel nauseous. You could also use calming oils, like lavender oil, which often helps with relaxation. The most important thing is that you like the scent and it doesn't cause any aversion. It is crucial that these essential oils are of high quality and not just cheap drugstore versions to avoid any undesirable allergic reactions. A heating pad can also provide pain relief. You can fill a regular heating pad with warm water and apply it to the area where it hurts. This can help. But you must understand that heat should not be applied near the area where the placenta is attached. If you use a heating pad, check with your doctor to find out which side the placenta is on. There is also an electrical stimulation device. There are different brands of these devices. You can rent one and use it as well. Electrodes are attached to the back and electrical impulses are delivered through them. It is believed this can help relieve contraction pain. Of course, a bath or shower helps a lot during labor. If the option is available, you can use them. However, maternity hospitals usually do not allow the use of a bath without professional assistance. Regarding the partner, what should he do? The most important thing is not to bring her out of the trance state. I sometimes observe during births that husbands are often very active. They want to know, how much time is left? What are your sensations? Maybe I can do something, bring something? Let's do it this way. Maybe you should eat, or something else. He asks too many questions, fusses too much, and might even make jokes. I had a case where the woman's husband joked very actively during labor. On one hand, everyone was having fun, and it entertained the mother. But because he joked so much and created a certain kind of fuss, her cervix spasmed at 7 centimeters of dilation and stopped opening. At that point, she was laboring without an epidural and managing the contractions well. But then the doctor had the idea to give her an epidural just to relax the cervix. Instead, we did this. I had the mother lie down, dimmed the lights, told everyone in the room to be quiet, and we meditated. I guided her through a specific meditation, one that is also included in your course. She relaxed, and in literally half an hour, the doctor checked again, and her cervix was fully dilated to 10 centimeters. So this unnecessary fussing can lead to such consequences. Try not to interfere with the woman giving birth. That is the most important thing. The partner should be there for support. He can periodically offer water or make tea if she wants it. He can provide a massage if she wants it, and exactly how she wants it. It is important to respond to her emotions on this topic. Ask, am I doing it right? Lower? Higher? She will guide you. And don't forget to remind her to empty her bladder every 2 hours. During labor, a full bladder will interfere with uterine contractions. It is also very comforting for a woman when her partner does breathing exercises with her during contractions. When he breathes alongside her, it somehow helps her relax. You know, it feels strange when you are breathing alone in a room and no one is doing it with you. This way, you can join her, and psychologically it will become easier for her. In the second part of the active phase, around 9 centimeters of dilation, the woman's sensations usually change again. Sometimes the contractions become slightly less frequent, and at this point she might start feeling a slight urge to push. The baby is engaging in the pelvis, and the head presses more on the organs, including the intestines, creating the sensation of needing a bowel movement. Because these sensations are changing and adrenaline is being released to give the woman strength for the second stage of labor and the birth, she might get scared. She wakes up from her trance state and starts saying, "That's it, I've changed my mind, I don't want to do this anymore, give me a C-section, I don't want to give birth anymore." These are normal things to say at this stage. The most important thing here is either to calm yourself down and say, "If I am feeling this now, it means I don't have much longer left." If a partner is by your side, he can say these words to you, "You can do this, you will succeed." It is very important that the partner doesn't pity her or say, "Oh, you poor thing," but instead says, "You can do this, you will succeed, I am with you." You can just memorize these phrases and repeat them, and believe me, it will work. What else can help you? First of all, thinking about the baby gives the mother strength. Remember that a child is being born with you. You are not just giving birth yourself. A baby is coming into the world, and right now you are helping them in every way you can. Talk to them, hold them, tell them there isn't much longer left. Say all these words to them. Try to maintain vertical positions, but if you are tired, you can lie down. Try not to tense your legs, spread them as wide as possible. Relax your pelvis during a contraction. If you have the feeling that right now you are going to have a bowel movement, don't be afraid of it. First of all, it's impossible to hold it in. Even if you didn't have an enema, the intestines are compressed by the baby's head and nothing extraordinary will happen, even if you have such intense sensations. But if you clench your muscles trying to hold back the process, you are holding back the baby and prolonging the labor.